Today we'll discuss diabetic ketoacidosis or DKA, that is diabetic ketoacidosis. It is also called as diabetic coma, which occurs as a complication in type 1 diabetes mellitus or insulin dependent diabetes mellitus. It is a complication of type 1 diabetes mellitus or insulin dependent diabetes mellitus, and it is not commonly seen with type 2 diabetes mellitus, or it is infrequent in type 2 diabetes mellitus, which is non-insulin dependent diabetes mellitus. Now, the most common precipitating cause of this diabetic coma is infection. Infection is the most common precipitating cause is the infection. Now, other causes like inadequate dose of insulin. If there is inadequate dose of insulin, so uncontrolled diabetic mellitus or uncontrolled hyperglycemia, then stress, trauma, stroke, and pancreatitis. These are the causes of developing diabetic ketoacidosis. Diabetic ketoacidosis results from relative or absolute deficiency of insulin. It results from either there is a relative deficiency of insulin or absolute deficiency of insulin, along with excess of counter regulatory hormones. Means diabetic ketoacidosis results from either there is a deficiency of insulin, which is relative or absolute, along with excess of counter regulatory hormones like glucagon, cortisol, growth hormone, and catecholamines. So, insulin deficiency and glucagon excess, they are responsible factors for the development of diabetic ketoacidosis. Now, treatment of diabetic ketoacidosis. First of all, we have to give insulin because there is a partial or complete deficiency of insulin or relative or absolute deficiency of insulin. So, to treat hyperglycemia, we have to give the insulin. Particularly, we give regular insulin, which is a shorter acting insulin. Regular insulin intravenously, IV bolus is given, which is given rapidly to reduce blood glucose level. So, what is the treatment for the diabetic ketoacidosis? Insulin is given to treat hyperglycemia or uncontrolled hyperglycemia. Regular insulin that we can give intravenously, and it is given to reduce the blood glucose level. Now, after that, IV fluids. Now, what is the role of IV fluids? Because there is a dehydration and sodium deficit. Because of dehydration and sodium deficit, and this dehydration and sodium deficit is because of vomiting, osmotic diuresis, and hyperventilation. Why there is a dehydration and sodium deficit? Because of vomiting, osmotic diuresis, and hyperventilation, there is a chance of dehydration and sodium deficit. So it is treated with the normal saline and lingon lactate. So IV fluids are given. Then potassium chloride or KCl. KCl is given because potassium stores are depleted in the diabetic ketoacidosis. Mainly during the treatment with insulin and IV fluid, potassium stores are depleted. So resolution of acidosis promotes potassium entry into the cell. Resolution of acidosis promotes potassium entry into the cells. Now, sodium bicarbonate. In severe acidosis, when pH is less than 7, in severe acidosis, when pH is less than 7, sodium bicarbonate is infused. And after that, antibiotics are given to prevent the secondary infection. So, this is how we treated diabetic ketoacidosis.